Thank you very much. And I am delighted to be here and I'm going to try and be as succinct in doing what I was asked to do, which was to reflect a little bit on the day and what's been heard and learned, as well as to share some thoughts and insights around kind of moving forward from here, particularly as it relates to kind of monitoring. How do you even know whether you're doing the right things based on all of the things that have come forward today? But I'm going to add a few little pieces to this, because probably what I've been most excited about was the conversations that was started at the end here, where we talked about patience more in this end panel than we did the entire day. And I think there's been pockets of the perspective of patience, but we've got a lot more to listen and to learn from around the voice and the value of patients and citizens and communities in the design of models of care, in the design of the monitoring systems, and in design of the various standards that jurisdictions around the world are putting in place and holding themselves out to be accountable for. And through my experience in this area of working so closely with patients, starting as a clinician and then through various parts of my career, most significantly over the past 8 years, of really working side by side with patients in almost everything that you can imagine that relates to improving the healthcare system. And I'm convinced more than ever of the value of that. And if we want to be talking about value in healthcare, I'd say, John, for your next conference and for here, to encourage to have the voice and the perspective of the patients in talking about value. And so that's one thing that I'd say is on a go forward. I'm not going to summarize the incredible presentations that were today. They were just absolutely exceptional, and I think what a great opportunity for the people of Alberta to be listening and learning from other jurisdictions. I think the main takeaway and reflection from that is the fact that we often will listen about what other people are doing, but we don't really internalize and think about, well, what could we do to actually take that, if it's worked, maybe experiment it a little bit with it, and think about the spread and scale of proven ideas and methodology, rather than saying, that was very nice. Now, we're really special here in Alberta or Ontario or whatever jurisdiction we're in, and we're just going to start from square one again. My observations as a leader who's had the opportunity to work even in the past 12 months in my capacity as CEO of Accreditation Canada, I've worked with every part of the healthcare system right across Canada and deeply in 7 provinces so far, and continue to move, and been working with clients and patients and policymakers and providers in 12 countries over the past year myself. And some striking observations that also came out here today. One, there's far more that unites us, actually, than divides us. So even though we heard many different versions, a lot of the underlying challenges that people are facing are very similar. And so if you think about needs-based strategies for going forward and improving value and improving care, I'd say let's make sure that we're actually understanding also that there's a lot of very common elements, common needs that can then be used as platforms for change to accelerate improvements, rather than we're so good at duplicating and reinventing. Canada, I would say, is, for all the positives about doing some things as pilots, we are the king and queen of pilot projects, and this is a problem, because we pilot everything and say, that's very nice, but then it's too difficult to put in place or whatever, and we just keep piloting and piloting, and we don't land the plane. And we don't implement in a way that's going to allow us to learn and continue to move forward, take the best of the learning from that. So I think we've got to experiment, but not continue to have the land of pilot projects. We're very good at that. I think the other piece is from seeing across the country and internationally, there's a lot of really universal needs that almost everyone is saying is underlying the quest for more value. And some of these, kind of in summary, are really around, people are all saying we need to be designing solutions and systems for people, not just for organizations, not for policymakers, but design them for people. Number one. People are saying universally they need, and this is from patients, policymakers, providers, from everyone, every part of the world that I've been to and talked to and research. They say we need to, there's a real need to better connect with each other. And that's with information, that's with connecting across silos and systems in new ways and learning through those connections. The third universal need is really about the need to listen to all voices, and that every person has vital information. We got to be really careful we don't step into the mindset of the we know best as a policymaker, as a provider, and patients, families, communities, people with lived experience in their own illness and conditions and jurisdictions have extraordinary expertise to bring. And in fact, many examples where we see where things don't turn out the way we think they should is because the solutions haven't been actually designed to the right problems. So listening to all voices and expecting that. The other real need, and I heard it through the day as well, that validates the need that we've really got to boil things down to what matters and focus on kind of those critical issues, because there's a whole lot out there. It's daunting to listen to the extraordinary input that we heard today of all the things that we could do and should do. And how do you navigate all that? And on top of all these great people, there's organizations like mine, legislation, regulators, other groups, and they're all jumping on our heads to say, you know, do this, do it in this way, and it's almost paralyzing. And so finding a way to sift through that, reduce duplication, simplify, and really focus on what matters is an extraordinarily important need that must be addressed as part of the reform process. And the theme that came out today, which again has been validated through my experience over the past year listening and learning from so many others, is the importance of linking data and decisions and practice to better health outcomes. I know even as our own practice of accreditation, which is one of a number of assessment models, you can get exemplary standing and have great process reports on how terrific you're doing, and you look at your Chi-High data on that same process, and you can pass with flying colors on your infection control practices, but you can have embarrassing and inappropriately low rates, or the low rates would be good, the high rates of infection and your poor outcomes. This is like one of the other inconvenient truths in healthcare, is we've got all kinds of things that are masking the real problems and not actually bringing the data together. So it says to you, how do we actually start to address those needs so that we can focus on some of these right things? One of the questions that John posed was, so where does monitoring all of this fit in? And I'd say, well, first of all, you got to figure out the right things at the foundation. And so you can have great monitoring systems and measurement systems, but if they're not helping, if they're not actually focused on the right things, then you're going to get all tangled up again and not have meaningful platforms for change. So even just as an example, as we listened and learned over the past year, there was a lot that I heard that was pretty sobering, but really consistent actually from where I saw things when I was a leader in the system myself, is that this gap between outcomes and standards is key. The question around, so where were these standards actually developed from in the first place? Kind of who said that this was the right way? How do you look and underpin? Who was around the table when the standards were being developed? What's the standard for the standards? And everyone's running around meeting standards, but we haven't actually stepped back and actually said, wonder if these are the right ones. And so that's part of getting underneath and making sure that that is right. And that's informing very much the kind of work that we're going to be doing coming out in this starting literally being announced within the next few days around how we're moving forward as one organization to help contribute to solving some of these challenges. Because even when you look at the types of standards, and you look at the types of incentives and many examples that were given today around measurements and the kind of dialogue and who's talking about what, we keep reinforcing the silos. We keep reinforcing the problems by continuing to focus on some of these existing pieces. What we're going to do is focus on, well, what should be in place? So what are the standards that we can move toward and the changes you can move toward, as opposed to reinforcing the same old things that are drawing you back? And so as an example, we've adopted, and I've seen it play out in many other countries, the World Health Organization, really simple but completely makes sense. The People-Centered Integrated Health Services Framework that was developed with the input, and it's now been adopted officially by 154 countries, including our own. And it's a brilliant model because evidence-based, a lot of local jurisdictions contribute, and it focuses in on 5 key things that actually contribute to the achievement of people-centered integrated health services. And so we're going to be taking that and saying, okay, let's look at everything going forward as helping to move toward that. So what does that look like based on some of the universal needs that I described? So what if standards weren't only for hospitals or facilities and all the individual parts? What if, to get to the integrated health services, regardless of governance, I don't care who's paying for what, I don't care what board structure you have, what if the patient pathway standard was there? And maybe what if, this is kind of heresy, and don't take it as our policy direction, but people have said the example, what if you had patient pathway standards around for people with COPD, living with COPD, as an example, in a rural area, and that was held out as a standard. People needing to, it developed also in the right way at a much higher level of rigor than currently is being done. And then what if nobody actually gets credit for meeting the standard unless everybody does? So you actually are incented and aligned around focusing on that standard as opposed to your individual, around the patient pathway instead of your individual piece. And what if there was these, the focus on putting some stakes in the ground around integrated health services, people-centered integrated health services, and the 5 features of that actually are consistently being reviewed and turned to in terms of the evidence that supports those. And so those, the questions around what do we need to be doing to actually act on the many things and great ideas and insights and excellent research that's been presented today, I think that there are a few things that we can start to do now, and that I'd encourage all of you to start to think and question now. So when in looking at rather than kind of blindly following all the kind of the directives and everything else, of actually making sure that we're creating the space where it's okay to question what are we doing and why, and stop. You know, there's a great part of the Toyota model and lean where in many care model redesigns, there's the notion of being able to stop the line. Well, we don't do that very well in healthcare from even at an administrative decision maker and leadership level, because stopping the line is usually meaning you're done because you've spoken out against something, or you're trying to, but we need to have the cultures where you can raise the questions, raise the issues, to be able to say, are we focusing on the right things? How do we move things together and actually move forward? So that culture and the winning conditions around enabling an environment for progress and change so that we understand value. Making sure that baked into everything that we do, you're looking at how you're engaging engaging and enabling people that are part of the care and the services that you're involved in, and making sure that those voices are heard and part of the plans. Again, there's so many great lessons learned, so many examples over in many jurisdictions around how that can happen, and that's, again, very important. But I guess one of one of the final messages is asking yourself really simply, what have I learned from a patient today? And whether you're a policymaker, whether you are an administrator, a clinician, another provider, if you can be asking, you're a researcher, you ask yourself, what have I learned from a patient today? You're going to be reflecting on how you're spending your time, your energy, your resources. You're going to be awakened by either the gap or the immense learning that you can have in order to reflect on what you're doing and how you're doing it. And I can assure you that Accreditation Canada, as we go forward, putting a lot more emphasis on the standards, putting a lot more emphasis on bringing client and family-centered care to life, right through to the old assessment models that we are introducing patients as surveyors. So that's going to be part of the new world, too. When you think about monitoring, about things that are related to monitoring whether or not someone's client and family-centered, you kind of scratch your head once you start to work in the new world and you say, okay, well, how can we actually make a judgment on that if we're not involving the people that are part of that value equation deeply? It's not going to be an easy path. It's not going to turn over overnight, but it is one example of one of the types of assessment models that are trying to put the teeth into better standards that are more relevant, more rigorous, focused on results, and meaningful at the end of the day to patients. I'm so pleased to have been part of the sessions today to stimulate our thinking. I really want to congratulate John and the Institute of Health Economics. I think this is a phenomenal gathering. Please don't let it fall and just land here. Use this as a springboard for dialogue. You've got a lot of the great leaders in Alberta Health Services here. You've got the grand experiment in your grasp. I can't think of an environment where there's more opportunity to really move the needle than in when it relates to value and health outcomes and improvement than in Alberta. And I say that and having literally traveling all around, because you've got all the ingredients for success. You got a lot of the winning conditions, and you've got some great talented people here. And if you can channel the energy of, rather than feeling frustrated with all the things that could be better, and channel that energy toward actually moving the needle and making great things happen with the patients and families and communities that you serve, I think that Alberta is going to be setting the pace for the rest of the country quickly, and really encourage you to take today and use this as a springboard. And you know that my organization and our experience from around the world, we are enthusiastic to share that and help you be the best that you can be. So thank you very much, everyone.